Scoliosis is an abnormal curvature of the spine. In the Philippines, this disease is not well known.
I have struggled mainly on back pains.
Other people who have this disease are treated differently. Scoliosis is an abnormal curvature of the spine. For most scoliosis patients, the symptoms are not found until the curve evolves more clearly. In the Philippines, this disease is not well known. And since there is scarcity of information, other people who have this disease are treated differently. Approximately 4 out of 100 individuals suffer from some form of scoliosis. The most common type is idiopathic scoliosis, which occurs in approximately 2% of the population. There are no statistics found here in the Philippines as to how many people are affected by this disease, and now more attention are being paid to the screening of individuals with scoliosis. To further look to this study, we conducted a documentary about the life of a teenage girl who was diagnosed with scoliosis. Flory Mutok, a 17-year-old girl who lives in Marawan, Nueva Ecija, suffers from scoliosis. She was diagnosed in her early teens and continues to feel back pain. Let's hear her story.
A pleasant day to all the viewers. I am Flory Mutok, 17 years old, residing at Sitio Bantog, Marawahan, Nueva Ecija, and I have scoliosis. I am the youngest in our family. Out of 4, 3 has scoliosis.
How long have you been dealing from this condition?
I've been dealing with this since I was in 9th grade. So starting from that, I have scoliosis for about 3 years now.
How did you get afflicted with this illness?
It was hereditary. It was handed on from our grandmother to our father, then to us. Among us siblings, only one doesn't have scoliosis. In fact, my cousins from my father's side are also suffering from this disorder. Some discovered it early, some did not.
How did scoliosis change your life?
At first, I didn't put much attention to it since it doesn't affect my entire life. But not until I started to notice my back curving a little bit. I became body conscious as the time goes by, like when I'm walking outside, in school, or in any public sidewalks. I felt embarrassed, so sometimes I forced myself to straighten my back. Most of the times, I bad shamed myself since I slightly have an even shoulder and back. So in conclusion, my confidence is a bit tainted because of this disorder.
How did you discover that you have scoliosis?
I said earlier that it was hereditary, so I kind of expected that this illness will fall on me, but never did I expect to have it so early. The only reason that I can remember is when we went swimming in the resort near our place. My friends and I competed on who is the fastest swimmer. My dive went wrong, so my whole body slammed into the water and it hurts. After that outing, I started to feel back pains. It wasn't noticeable then, but now you can see how my shoulder and back is uneven. So I assumed that this illness was triggered by that wrong dive.
What are your struggles caused by the said disease?
I have struggled mainly on back pains. There are no days that I don't feel pain, like when I straighten my back, I feel pain. When I lay down, I feel pain. When I woke up, I feel pain. And there's no ending pain. I am also not allowed to do some recreational activities. For instances, heavy workouts are not allowed. Another is when traveling. Normal people felt pain when traveling, but for me, it was kind of double.
Now let's welcome Dr. Sofia Andrea Paraino from St. Luke Medical Center to give us a more detailed information about what scoliosis really is and how it affects the human body. So, Dr. Paraino, can you give us some insight about this disease called scoliosis?
Scoliosis is a disease that can definitely change one's life. It is a type of disease which is commonly found in the skeletal system, particularly in the spine. This often occurs in childhood and adolescence, a condition where the spine curves to varying degrees in an S or C shape. It is either to the right or left side. And this disease is about 3 to 5 of 1,000 people are affected. We have several types of scoliosis, but the most common for diagnosis is these 4 types: the idiopathic, early onset, congenital, and the neuromuscular. Although these various forms have different causes and affect different age groups, they all develop in a similar manner. In Flores' case, as she said a while ago, she starts seeing the symptoms on her 9th grade, which is probably on her 13 or 14 years of age. She also added that it was a hereditary, which she inherited it from his father. So basically, from this diagnosis, I conclude that this is an adolescent idiopathic scoliosis.
Doc, what causes scoliosis?
In most cases, 85% the causes of scoliosis is unknown. The other 15% of cases fall into 2 groups. These are the non-structural, the functional, and this type of scoliosis is a temporary condition when the spine is otherwise normal. The curvature occurs as the result of another problem. While the other group, it is the structural. In this type of scoliosis, the spine is not normal. The curvature is caused by another disease process such as a birth defect, muscular dystrophy, metabolic diseases, connective tissue disorders, or Marfan syndrome.
What are the symptoms, Doc?
Well, the symptoms are visible. We may identify it in the first hand because the physique of a person is changing. Example, one shoulder blade is more prominent than the other, rib cages are at different heights. An even waistline. They may also walk with a rolling gait, and the spine is not in the normal shape, and of course, they experience back pain or tire easily during activities that require excessive trunk movement.
What are the risk factors for scoliosis?
If someone in the family has scoliosis, however, the likelihood of an incidence is approximately 20%. And since the symptoms typically occur between the ages of 9 and 15, we can say that age is a risk factor. But in some cases, they are born with that kind of disease, and that is what we call congenital scoliosis. In this case, the baby's spine didn't develop fully in the womb. Scoliosis is more common in women, and they have a higher risk of worsening spine curvature than males.
Doc, what is the most alarming effect when having scoliosis?
Although most people with scoliosis have a mild form of the disease, it can sometimes lead to complications such as lung and heart damage when we don't treat it as early as possible. The rib cage may push against the lungs and heart in severe scoliosis, making breathing more difficult and the heart pumping more difficult.
So, what is the treatment we can offer to Flori?
In Flores' case, she had a mild curvature that it is less than 20 degrees.
Doc, another question. Regarding the degrees you're talking about, what is that?
Regarding in that is our basis to measure if the patient is in severe condition of scoliosis. In general, a mild curve is less than 20 degrees. Curves measuring over 20 degrees is a moderate and may require treatment. And curves greater than 50 degrees is what we call severe and will likely need surgery to restore normal posture. So back in Flores' treatment, as I've said earlier, she has a mild curve and it is less than 20 degrees. so she won't probably need the treatment with a brace and surgery. Our goal is to slow the curve's progression, correct the curve, prevent related health issues, and delay the need for surgery. It is most likely observation that she needs, periodic checkups and x-rays to be sure that the curve doesn't worsen, and of course, a healthy lifestyle and a posture.
So, thank you, Doc.
Thank you.
Now let's welcome Dr. Jara Venice Martinez to explain to us what are the possible risks in Florey's cardiovascular system. So, Doc, can you further explain to us the risk Florey may be facing?
Before I answer that question, scoliosis. When we say scoliosis, it is a disease that can worsen over time. Sometimes a curve that develops during infancy or early childhood, unnoticed and untreated until the teenage years. The abnormal position of the spine can affect the development of muscles and ligaments associated with the spinal column, causing the ribs and pelvis also to twist and to rotate to the side. We have two rare possible risks in our cardiovascular system that may happen by having a scoliosis. First one, we have the heart problem. It is where the scoliosis is associated with the abnormal heart mechanics, such as the heart valve abnormality, or known as the mitral valve prolapse. Second one is the congenital heart disease. It has a recognized association with scoliosis. It is rare due of it only affects 1% of live births, and also congenital heart defects are commonly type of birth defects. It is not clear whether the abnormal shape of the upper body leads to this problem, or if the valve and spine both develops abnormally because of the single growth problem. Thank you for listening.
So, thank you, Doc. Scoliosis remain incompletely understood despite a collective experience that approaches 4,000 years is a sad commentary on the learning curve of medical practitioners. Nevertheless, the history of recognition and treatment is rich with important lessons for modern practitioners. So, Florey, is there any message that you want to say?
My advice to everyone who have scoliosis is that don't ask validation from others. When you ask validation from other people, it's like admitting that you were invalid, which is not the case. Everyone deserved a righteous judgment, so never ever let your confidence down.
People who have scoliosis are just like us. Their body may look different compared to most of us because of what their disease are causing to their body, but it doesn't mean that they are less of us. So always be kind because we don't know the battles they are facing for each day. And for those people who have scoliosis, always remember that your disease don't define you.